There is no one who is not fearful of instrument separation, including those who have expertise in instrument retrieval. No one wants instrument to be separated in their own case by them. So, what are the reasons for instrument separation? Out of all reasons of instrument separation, the most common is overuse of instrument. We, the dentists, somehow tend to fall in love with the file and forget to discard it. And when it breaks, it certainly breaks our hearts too. Keeping joke aside, we need to protocols that in how many canals and how many autoclaving cycles we are going to subject to the file. We should not break our protocols and stick to it. Our protocols are we do maximum of 8 canals or maximum of 2 autoclaving cycles post the first use of file. That means we are going to use the file in either 2 or 3 cases. If you may feel it's too less, you can choose your own protocol, but it should not be more than 12 to 15 canals for sure. Majority of manufacturers suggest to use the file for single use only. So what else can be done to avoid instrument separation? First, never use instrument in a dry canal. There has to be some lubrication inside canal, whether the file should be coated with EDTA gel or canal filled with sodium hypochlorite or even blood, but file should never be used in a dry canal. Second, take benefit of improved metallurgy, especially in curved canals. Metallurgy of NiTi has undergone too many developments, and now we have files like controlled memory files, electrical discharge machine files, which can cope stress of severe curvature better. Now what if instrument separation occurs? First thing is to stay calm and understand that if the instrument has separated inside the canal, then it's not the instrument that will cause failure. It's the infected debris that we are not able to clean and disinfect leads to root canal failure. If we are able to bypass or retrieve the instrument and follow all the protocols rigorously, a root canal treatment outcome is going to be predictable. Bypassing a file needs a lot of patience and lots of lubricant and lots of 10 number files. Bypassing in an oval canal is lot easier than bypassing instrument in a round canal. There is no time limit in which bypassing will be done. It may take 10 minutes or it may take more than 1 hour. Only thing to remember is once your file starts to engage the broken instrument and you start bypassing it, do not reuse that particular file. We have seen cases where the files which were being reused for bypassing breaking inside the canal alongside already broken instrument. Just start patiently trying to bypass from each side. Try buccal and lingual side first, then try mesial or distal. The first point from where you get a purchase, or I may say you start bypassing the canal, go from that side only and try to bypass completely and slowly keep on doing with larger instrument. And I always finish that canal with hand files where I have bypassed an instrument. I don't use rotary files in that canal afterwards. Instrument retrieval needs magnifications, most probably microscope, and requires specialized file retrieval kits. None of the file retrieval system is foolproof that each and every time you shall be able to retrieve the file. Few popular systems are BTR Pen, Maceran Kit, Tirochi File Retrieval Kit. Bypassing of the file anyhow is always better if possible. As for retrieval, lot of sound dentin needs to be removed.